Today's presentation is on understanding classification for para-equestrian sport. It's presented by the USEF, USPEA International Para-Equestrian Dressage Centers of Excellence, and it's intended for coaches and athletes. Support for this course is made possible by the Department of Veterans Affairs through an adaptive sport grant that was awarded to Carlisle Academy Integrative Equine Therapy and Sports, and is done in partnership with the United States Equestrian Federation and the Professional Association of Therapeutic Horsemanship International. The information in this presentation may not perfectly reflect the most updated USEF FEI para-equestrian rules. It's the responsibility of the athlete to check the USEF FEI para-equestrian rules, which are updated annually. The overall course objectives for all of these presentations include developing a foundational understanding of national and international competition in both para-equestrian dressage and para-equestrian driving, to raise awareness among riding schools, therapeutic riding centers, veteran service organizations, and adaptive sport clubs about these exciting Paralympic and international sports as a competitive pursuit beyond equine-assisted therapy or recreation. We have a goal also to connect emerging coaches and athletes to the USEF, USPEA International Para-Equestrian Dressage Centers of Excellence, which provide training clinics, educational symposia, and access to international para-dressage coaching experts. And we want to encourage para-eligible veterans to participate in the Department of Veterans Affairs Veterans Assistance Program with trained, knowledgeable coaching support. We are so excited to have Carrie Sowers with us today to present on the topic of understanding para-equestrian classification. Carrie is an assistant professor of health sciences at Stockton University in Galway, New Jersey. She is a FEI Level 2 classifier for para-equestrian sport, a United States Equestrian Federation national classifier, and serves on the United States Equestrian Federation Adaptive Sport Committee. In addition to her experience as a classifier, Carrie is an accomplished dressage rider who has competed successfully through the FEI levels.
So I'm going to go over a little bit about classification for you guys. It's sort of always had this slight mystery about it. I know when I first started in getting involved in para as a groom, it was, you know, oh, the athlete has to go in and get classified, and it was kind of this mysterious air to it. IPC, so your International Paralympic Committee, is really what kind of adopted the language for what is classification. And it's really, how do we group athletes? And I always like to think of classification as beyond apples and oranges. We're doing like apples, oranges, cherries, grapes, pineapples, and putting it all into, you know, a couple different baskets. So it's not even as simple as apples and oranges. But we're trying to group athletes into their sport class. And so you'll start to hear sport class as sort of a newer terminology. This is basically equivalent to grades. So when you see a grade is the same thing as the sport class in terms of IPC language. So that's what we're trying to do. And we're trying to group them based on how does their impairment affect their ability to function in that sport. And so they may be in one sport class for one sport and be in a different sport class for a different sport. So as a classifier, you really have to have some kind of foundation in your sport. So for me personally, I only classify for para-equestrian. I'm not allowed to classify for swimming or track and field, athletics. I don't have actual sport experience in those sports, so I have to stay within my sport. I have friends that classify for swimming or for athletics. They can't classify for para-equestrian. They don't have that equestrian foundation to kind of understand the sport requirements itself. So that gives you guys a little background on that. Little brief, really brief history. There's a great movie that you can, and I forget the title right now, but there's a great movie that tells you a little bit about the history and kind of foundation of parasports. It goes back to Dr. Ludwig Guttmann in 1950s or so. He was a German-born physician, that neurophysician that left Germany in the war, went over to England, and started working with a lot of spinal cord patients. And the history is kind of that he went into one of these spinal cord rehab centers, and the lights, the shades were down, the lights were off, you know, nobody wanted to. And again, a lot of veterans. These were mostly veterans, which actually started the foundation for the para program. And you know, everyone was laying in their bed not moving because that was what you did at that time medically. And he kind of took he took exception to that and said, they're people. They shouldn't be just lying in bed at 18, 19, 20 years old and not moving and not involved. And so he basically kind of said, we're going to totally change the way we treat these patients. And so one of the things he felt was really valuable was sport. And sport kind of brought people out of their shells. It got them moving in a way that wasn't painful physical and occupational therapy that they really were dreading. And so that's really the whole kind of foundation about Para program. So initially when they started out, they classified patients or participants and athletes based on their impairment. So they were spinal cord and what level, they were brain injury and what degree, and that was what sport class they competed in. A lot of your initial were archery was kind of one of your founding para sports. So they basically just said all the spinal cord injury patients or athletes at this level, we're going to participate in this archery group. And all of the ones at this level are going to participate in this archery group. And that was kind of the foundation for sport classes. So we've kind of come a long way. And around the 1980s, we started to transition that medical-based system of, spinal cord injury or brain injury or amputee or those kind of diagnoses to say, now we're getting too many people, and how can we kind of manage that sport a little bit better? We can't have 20, 30 different sport classes and manage a competition. And so they started to go to that more functional-based system. They also started to see that, some amputees, even though they might have the same level of amputation or the same level of spinal cord injury, they started to see that they had different functional levels. Some could do more, some had more difficulty. And so then they were seeing that there wasn't kind of this fair balance in sport. And so we made that kind of transition to a little bit more of a functional system instead of just a medical-based system. We're now kind of transitioning again. So you'll see a little transition through classification probably over the next 5, 6 years or so. Where now the IPC has actually tasked all of the different classification systems to provide evidence behind why we just do what we do and how we classify athletes. And so we have to kind of get the scientific research that comes up to speed to say, this is why these athletes are in this sport class, this is why these athletes are not eligible, this is why we have a minimum criteria, why is it 15%? We need actual scientific evidence to document why we're doing that. So that's kind of where all of the different sports are at this point, and that's to kind of keep our standing with IPC and move the sports forward a little bit. So basically there are, when you look at para sports as a whole, there's really 3 different kind of impairment overview models. And one is physical, and to be a classifier for the physical impairments, you either have to be a physical therapist or in Europe a physio, or you have to be a medical doctor. It's a little challenging in the US. They don't recognize occupational therapists, which has been a little bit of a debate because again, it's a European standard and European model, and so in Europe they don't really recognize that field and profession of occupational therapy. Even though in the US we're saying, okay, our OTs have the same training and background and can do that. So right now it's only physios and medical doctors in the US and that can classify for physical. For visually impaired athletes, those have to be classified from an ophthalmologist or a trained optician. So usually it's an ophthalmologist that does those classifications. So I, as a classifier, can't do that for visually impaired because I don't have that training or that certification. So they have to go to special classifiers. If there is a physical component on top of that vision component, they'll get classified by both of us. So they'll get a vision classification and a physical classification as well. And then there's the intellectual impairment, which in para-equestrian sport is not recognized as an eligible impairment. We do have it as a sport class, but it by itself is not eligible. So with parasport for us, for para-equestrian, there has to be some kind of physical or visual impairment overlap with the intellectual impairment. So they can have an intellectual impairment, and that's completely okay to compete, but there has to be a vision or a physical component as well that meets criteria. So, and again, whether we see that change over time as we have different evidence with classification, we'll see. We'll have to see where that goes. National versus international. So the biggest difference is, when we do national classifications, we tend to classify anywhere and everywhere that we're available. So I've classified at horse shows, I've classified at the university I teach at, I've classified at trainers' barns. We've been very flexible. We're trying to move it to more either horse shows or the COE locations just for liability reasons, just to kind of protect the athlete, protect the rider, and the classifier as well. You only need one classifier that's a USCF kind of approved or trained classifier for that. It can also be an international classifier who's acting as a national classifier. So like I am an FEI classifier, but I can go and just do a national classification. So basically one classifier. That national classification only works for you through national events, national shows, national championships. It will not carry over to an FEI competition. So that's always the challenge. And FEI has now mandated that any athlete that wants to get FEI classified should ideally have a national classification first. And so that's something new. We used to have a lot of riders come up and just kind of show up for their FEI classification and either weren't eligible or weren't really ready to compete at FEI level. And then we had, when we went through our kind of master list, there was a lot of inactive athletes because they had just gone for classification because they were told, oh, go get your classification, but they never actually competed or intended to compete at FEI level. So we're trying to get a little bit more strict about you go for national classification first, then you can go for FEI classification. We use the same system, so our FEI profile system, so everything really is the same for national classification what we do, how we test, how we use the sport classes, all of that is identical for FEI as it is for national. When you go to an FEI classification, you basically go through the same process. So if you're an athlete and you're going to go through, you've had your national classification and now you want to get your FEI classification, the process is the same. So we review the medical records the same way, we go through the testing the same way, except there's two of us. And so that's a little bit more of the challenge. And that's why it can add expense to the FEI competitions, because now you have to have two international classifiers come. One can be from the country that you're from, and then one has to be from an outside country. And so this kind of, again, tries to keep that fair playing field that we don't have two US classifiers that are kind of tweaking the system and making that athlete a lower grade or doing something a little bit funny. So it keeps everything is balanced, that you've got someone from an external country and then, usually yours. Some of the countries that don't have classifiers will obviously have two outside countries as classifiers. And so that's the process. And so, it's nice to work in tandem because if you're a little bit, again, the system's not a perfect system and there is some subjectivity in it. So it's nice to have two experienced eyes kind of making a decision, especially when you're making that final decision for this athlete. So that's really the biggest part. The other difference with national versus international is national, we do a dispensation certificate. So once I've classified an athlete, that information goes back to USCF, and USCF produces that dispensation certificate, which says what compensating age. So what is the profile number, what's the grade of that athlete, the sport class, and then what are the aids that can be used. When we do the FEI classifications, that goes to the FEI. FEI puts that information on the master list, and that's accessible from everyone on the website. So those are the kind of key differences. The other thing that's a little challenging that we still have to deal with that you guys might notice as you do national versus FEI is when we do your dispensation for national, we have to put every and any possible aid you might use, which might include sitting or rising trot or no gloves or things that are automatically assumed by FEI. So on FEI now they've gotten more strict about what aids, and there are certain aids that all para riders are allowed to have. We don't have to list those on your FEI certificate because they're assumed. Everyone can use them, so they don't have to get listed. When we do national, because you guys are sometimes going to local shows that aren't as familiar and they're not as comfortable maybe with the rules and the regulations, we have to list every possible thing you might or might not use, even if it's assumed. And so a lot of times I'll have riders say, but I had all of these things on my national card, why aren't they on my FEI master list? And that's just because FEI already knows what aids are okay for everyone. National, it gets a little bit kind of gray because a lot of organizations, like local shows and events, don't know all of those aids are okay. And so we've right now still list them just to make sure you're covered. Hopefully as education rolls out, we won't have to do that at some point, but just so if you see that difference, you're knowing why. There are basically 10 permitted impairments, and again, this comes from IPC, so this is really for all parasport, and so these are the different things, and you guys can read through them, that are considered kind of the key recognized impairments that allow you to compete as part of parasport. And so again, the star there is intellectual. This is not accepted for all sports. Some sports do intellectual only. Many sports still do not, and there's some history that we won't go into of that reasoning of why some of the sports don't recognize just intellectual impairment. So this is really something you can kind of skim through and just look at, and hopefully most of our athletes are falling under one of these kind of, or more than one of these impairment categories. Minimal impairment criteria, this is another kind of gray and touchy topic nowadays with parasport, is there has to be a certain minimum criteria for you to be para-eligible. And this is always one that's a little bit under debate, is how do we decide, is it 15%, is it 20%, is there a certain kind of cut point? Should there be a cut point? You know, if you have an impairment and even though you have full strength or full range, should you still qualify and be eligible? And so again, this is one that, you know, we may see kind of change or get modified in the upcoming years as we discuss it and look into it more. But really right now it was kind of just, you know, decided that 15% was our cut point. So if you have an ankle fusion, usually that's enough to make you para-eligible. But, you know, again, some people will say you can ride with an ankle fusion and ride just as effectively as an able-bodied person, you know, and you make your own adaptations. So it's a little bit, again, of a gray area on how do we decide. But basically, we have certain numbers and certain values, and if we don't have that minimum value, then that person is not eligible, even though they have a recognized impairment. And that's always a, you know, difficult thing to tell an athlete when you get into that situation. So we'll see where that goes. And the impairments have to be measured. This is always, again, another challenge. We can't measure certain things like pain, fatigue. We can't measure them. I could ask everyone in here how tired you are, and, you know, from 0 to 10. And we could even be all the same level of tired, but we're going to hear 2s and 8s and 6s and 4s because we all perceive it a little differently. And so we can't really use those kind of hard to measure kind of pieces as part of our objective classification. So it has to be something we can measure. The process for classification is really, again, this is the same whether it's really national or international. So the first part is, you know, if you would like to be classified, you have to apply to USEF, and this is national again or FEI. So if we have athletes that come up and they want to get a national classification, they need to contact USEF. It used to be a lot more free, and they call up Joanne or Tina or I and just kind of ask for classifications. We've tried to streamline this through USEF so that we have a process in place and we're not getting random calls for classification all the time. So if you're, you know, nationally, you're calling USEF and they're contacting us and putting you in touch with one of the classifiers, then we'll ask for medical records, we'll ask for certain documentation so that we can go through that process. We'll then determine if, you know, through the classification process, you know, if you're eligible, if you meet that criteria. We'll decide what your profile is, sport grade, you know, sport class, and so grade. And then we designate a status, and I think there's another slide that goes into the status a little bit further. So that's kind of the same process. If you're looking for an FEI, so say you have a national classification, you want to go get your FEI classification, process is the same. You contact USEF. The federation is in charge of actually kind of coming forward and putting your name forward to FEI. So they are the ones that have to do this. We used to be a lot more kind of flexible, where we would have riders come up actually at the competition and say, hey, I need a classification. Can you do that? And we'd be, okay, let's try and get all your documentation and scramble and do it. Now I believe it's like a 6 weeks prior to the competition. So if you're looking at having a rider get an FEI classification at one of our January competitions, you want to have all of your documentation in place and into USEF so they can submit it to FEI 6 weeks prior to that event. So you want to actually start a couple weeks before that because you need all of your documentation to go to the federation. They need to look at it. The federation then sends it to FEI. FEI reviews it. If there's things missing, they'll ask for that documentation to come back. And then they'll approve everything. And part of that is because there are some medical conditions that we need a little more documentation. And we have some, obviously, that you can see if you have a spinal cord injury and you've got a physician to report that you have a spinal cord injury at a certain level. It's clearly evident, and we don't really need more proof. Or if you're an amputee, amputees are always the easiest. You know, they walk in and it's like, yes, I realize you're an amputee. I really don't need anything but the doctor's certificate that says, you know, I've treated you for X number of years. So they're the most straightforward. But there are other conditions like Guillain-Barré, some of the RSD, so complex regional pain, some even MS, that's a little bit tricky. And so especially those riders that look fine on the outside, but then, you know, and they come in, and so we need those additional documentation. And part of this is, again, going back many, many, many years when Para first started. It was like, oh, do you have a diagnosis? Okay, it's fine, we'll put you in. But really, it wasn't a diagnosis that was eligible. And so now that rider's been a Para rider for 20, 30 years under a non-eligible diagnosis. And so that's what we're trying to avoid. So we've gotten much tighter with the paperwork part of it, in that you have to have all of that medical documentation so we know you really have a diagnosis. Because again, as Para's gotten more popular in some countries and athletes are getting paid to actually compete, there's a little more kind of desire to kind of say, okay, I have a diagnosis and I'm just going to sneak my way into para sport this way. So we have to be a little more strict on that. So that's really the process. So it all goes back to USCF. Our procedure, so whenever I get an athlete in for classification, our procedure is the same. We do an athlete interview, so we get some background information, we get just some foundational information, assistive devices, things like that that you might use, medications, just basically a history, so we know what we're actually going to be testing and dealing with. We have 3 different ways to assess a rider, and we can use those 3 different ways either one way, or we usually use a combination. So we either do a range of motion assessment, we do a strength assessment, or we do a coordination assessment. And we can kind of mix and match this, although we tend to kind of stick with one or the other for the most part. Depends on what the athlete's diagnosis is what will kind of guide our decision into what assessment method to use. So if we have an athlete that's an amputee, it's straightforward. We're measuring range of motion. If they're above knee, their knee doesn't exist. There is no range of motion. So we do different measurements for them in terms of what their residual limb length is. For, you know, say an athlete with arthrogryposis or something like that, we'll do range of motion again because their joints are really limited. For an athlete with CP, we'll do coordination because again, usually it's more coordination. Brain injury is usually more coordination. So the athlete's medical diagnosis is what drives our testing method. Because we actually want to find where the most impairment is, where there is the most limitation. So we want to try and kind of get the part that's the hardest for the athlete and test that. We then go through that. We have a lot of different profiles that we can choose from, and so we get a scoring. So we get a score for each arm, a score for the neck, a score for the trunk, and a score for each leg. So we have this 6-score system that we look at, and there's certain max points in each part of that system. And then we have our profiles that are there, and we try and match up. And this is the part that can get a little tricky, but there are different profiles that might say weakness on one side, you know, mild weakness on one side, or severe weakness on one side. So we might try and say, okay, does this person match, this athlete match that profile? Or, you know, again, you know, the amputee is a little more straight. There's just one leg that's weak, or one arm that's weak. Or we might have one that's globally weak or incoordinate. So it's a little bit of a process. Some go really easy and some are really challenging. There are a handful of dual profiles where you don't really fit in one. You have to kind of get this merger of 2 profiles. We are trying to get away from the dual profiles. It's not something that IPC really likes. So we're trying to kind of steer away from that just to make the process a little more straightforward. Once we do that, we also will watch the rider. So we try not to watch riders before they actually do their bench testing with us, mostly because it's not my job to assess skill. My job is to assess functional level and impairments. And riders are really good at compensating and kind of hiding those impairments on a horse. And some riders that are really skillful, we don't want to penalize. And so we do our bench testing without watching the riders on the horse as much as possible. Sometimes you can't help it, but we try and avoid that because we don't want to bias our assessment of impairment and function with their skill. It's the judge's decision, the judge's job is to watch skill. Our job is to look at how does the impairment or the medical diagnosis impact function on the horse. However, we always like to double check ourselves, and some athletes are not always so motivated during the classification process, and so we like to verify that what we saw on the bench is what we see on the horse. And so once you put an athlete on the horse, if they were kind of not putting out their best effort on the bench testing, you will see it on the horse because now they're competing, and if they don't put their best effort out, they're not going to win. And so if we saw in a rider, maybe in our classification testing, that couldn't move their ankle at all, and suddenly they get on the horse and they can, dorsiflex, they can mount this, climb into the saddle and get up and push off, we have to question how accurate our assessment is. And we can then at that point pull the rider back in and reassess them, especially a new rider at competition. So we do this just to kind of make sure we have people in the right place. And sometimes you have an athlete that's borderline. They're really maybe right on the verge of a grade 1 or grade 2, or a grade 2 or 3. And maybe a 1 or 2 scores can push them either way. There's a couple of profiles that are pretty close. And so we do that observation to kind of verify that, yes, we put them either appropriately in that higher or that lower grade. So it's just kind of a check process to make sure we're getting it right. Most of the time it works pretty well. So classification, again, we really went through this pretty much. So this was your, you apply through USEF, you get your application. There's 2 documents that we need, so consents and medical diagnosis forms, extra medical reports. We do the athlete interview, and then the decision to what we're going to test and how we're going to test that athlete. So this is kind of a review of all of that information. Again, we decide the profile sport class. The status really new, review, or confirmed. So basically we have different options as classifiers when we see an athlete. A lot of times we'll get athletes that come, like, if I'm down in Florida classifying, maybe they'll just fly down to get their classification. They don't want to put all the money into competing until they know really what sport class they're in. So we might see that rider just for their bench test and not be able to see them on or off, horse. And in those cases, the athlete gets designated as new. So they're still really new to us. They haven't been confirmed into that profile or that sport class yet because we haven't seen them actually on the horse. So the athlete will carry that new status forward until they are at a competition or another event where we as classifiers can observe that athlete riding. A lot of our national classifications end up being new because we rarely get to actually see the riders on a horse after a national classification. But for FEI, it's really, we have to see that rider before they actually compete or do any major competition to verify that they're in the right sport class. So that's the new rider. The next one is review or confirmed. And as classifiers, we have the kind of capacity to make that decision as to whether this athlete is not going to change. So if we feel that their status is fairly stable, if they're an amputee, hopefully that's not going to, their limb length isn't going to change, they're not going to have a revision. Hopefully it's pretty static. So there's no point in making them go through a classification every year or 2 because nothing's going to change. So usually with like our amputees, once we've seen them ride, we'll make them confirmed, which means they don't have to go back for a classification process unless someone disputed it or unless they had a medical event that suddenly made their condition change or added a new condition. So that's confirmed. They're done, they're set, and that's their sport class. We also have some conditions that are really fluctuating. So a lot of our MS, maybe some of our younger athletes. So if we have a younger athlete that's maybe 14 or 15 and has some kind of neurological, even some of the CPs, which are somewhat stable at that point, but they're young, so they're still developing physically. We may put them as review for a couple of years until we can kind of see that they're pretty static in where they are. Again, some of those other neurological conditions are they fluctuate. And so that athlete might have a really bad year, but then they might get a lot better with different medications and treatments, and then so it's going to change. So what we do is we will periodically reclassify and reassess that athlete to make sure they're still in the right place, and that they haven't been classified at a low grade and suddenly now they're doing a lot better and they're not riding where they should be. Or some of them, were classified pretty high and they really deteriorated. That was one episode I had last year. We did a classification and it was a younger girl and she had actually deteriorated 2 sport classes. And that was one, she left in tears. She wanted to be at that higher, which usually doesn't happen. Usually it's you drop 2 grades and they're like, yay, I can be, competing a little more and more competitive. And she dropped 2 grades and she was in tears. She was so heartbroken that she had, because it kind of made her realize how bad her disease had progressed at that point. So that's a little bit of the tricky one. Sometimes we'll leave a rider review for a number of years and then we've realized, their classification hasn't changed the last 3 times. Now we can make them confirmed, even if it is a fluctuating condition. So it's a lot of kind of clinical decision making that goes into that process. We also help decide the compensating age. So these are based on profiles. So there are certain profiles that allow you to use certain equipment. Some equipment you can't use for certain profiles. So based on the profile, that'll help us kind of guide that standard equipment. Anything that's non-standard has to go to FEI, so it goes through USEF to FEI as a request for a non-standard aid. It used to be, again, a lot more flexible, and we kind of make those decisions on the fly. And then there was a lot of equipment being used that was altered or changed or adapted, and so we've kind of cut that out completely, and so as classifiers, we're not responsible for that. There's a compensating aids group that makes all of those decisions as to whether it's safe and it's not going to interfere with sport. So we just do the standard aids, and then, again, nationally we will have input. So a lot of times as national classifiers, USEF will have maybe a rider that requested a non-standard aid, and they'll kind of pass it to us to glance at before it gets sent into FEI, so that we can kind of add input as to whether we think maybe this is realistic or it might get turned back for a certain reason, just to kind of help our national athletes before they submit things like that to FEI. So sometimes we'll kind of do a glance over, but we don't make decisions on that part of it. So assessment, as we said, there's either strength testing, range of motion testing, coordination. Again, the vision testing is done by a different classifier who specializes in that. And there's typically not very many opportunities for visual classification. Nationally, we do have some of the IBSA, which is the Blind Sport Association, so we do have contact with a few IBSA classifiers that will kind of pre-look at everything, all the medical document, and give us a kind of preliminary vision classification that we can use for national. And then if it's FEI, there's usually maybe 1 or 2 locations in the world for vision impairment classification each year. So they've been doing it at Hartbury in England, trying to have a few classifications there for visually impaired for FEI, but it's a little harder to get done. Again, the hard part is we can't take into account pain, endurance, fatigue, those kind of conditions. So that's something we just kind of have to ignore. So I usually tell people when I'm classifying, if we have an athlete with so much pain that we can't test them, we can't finish that classification. So that's really a challenging one because we can't get a good assessment. So that's just something that, again, they're not eligible impairments, so we just have to we recognize them, but they don't factor into our classification process because we can't measure them. So profiles, so there's 37 eligible profiles for Para-Equestrian. There's actually more profiles than that, but some of the profiles are not eligible. So if you look in snoop around the classifiers manual, you'll see like 40 some odd different profiles. So some of the profiles are not eligible, but they're profiles. So again, what we do is we kind of take all of these profiles and we group certain profiles into a sport class or a grade. And that's kind of how we decide who rides grade 1, grade 2. And it's a system that looks at, again, you're not going to make everyone exactly equal, but it tries to put kind of similar functional impairments together as best it can. And so that way we hope that the athletes are sort of on the same playing field, even though they may have very different impairments or medical diagnoses. So this is the challenging part of it. I'm not going to read through these so you guys can glance through, but basically to make it easier, we did go through recently that switch to grade 1 through 5. We were confusing everyone with our use of grade 1A and 1Bs. And so part of that was actually a switch just for sports to kind of make it easier for our spectators to understand. If we want our sports to stay in the Olympics and Paralympics, we want to make sure our spectators can actually understand it. And 1A and 1B was totally confusing a lot of the spectators, so they finally made that switch over to just 1 through 5. So as you talk to some of us might do that old, wait, grade 2, no, 3. And so we're still switching over mentally as to what grade everything is. But basically your grade 1s are your most severely impacted. They have the most disability that there is. Oftentimes they're usually wheelchair users. They're not always, and so that's always the hard thing. People like trainers and coaches and other riders will start to look at riders and say, well, you know, everyone else is in a wheelchair, but that person's not, so why they shouldn't be in my grade. And so again, there might be other reasons as to why they're in that grade or that profile. So grade 1's the most severely impaired. It moves its way up to grade 5, which is our least impaired athlete. And so there's different, these are just kind of general, it's not absolutes, but just general summaries of what functional impairments usually end up in each grade. We do have a grade NE now, which is not eligible. So we have done classifications where someone will have either medical documentation that does suggest that they have an impairment, but we test them and they don't meet that 15% minimum criteria. So we do have to now actually mark them as grade not eligible, because again, you have that opportunity to go up for a second FEI classification if you've been made not eligible. And so riders will take advantage of that. So if you, again, you go up for your FEI classification, you've been made not eligible, you can then request one more additional review and classification with a different panel of classifiers. If they again find you not eligible, then you cannot apply for an FEI classification again with that medical paperwork. Obviously, if something horrible happened and you suffered a spinal cord injury, you could obviously then go back and get reassessed for classification. But based on the medical evidence you present, you could not go back and get classified again at that point. So we do now actually keep a running list of people that have applied and made not eligible so that we can track that, because what was happening years ago, and probably some extent still does, is people would go shopping for classifiers that they thought would be easier, nicer, less harsh, and so they would actually travel to certain shows because they knew which classifiers were there, and maybe they would be more likely to be made eligible or put into a lower profile. We've done a lot of training the last couple of years to try and make sure we are really all testing the same way and looking at the same things to try and eliminate that. But we're human, so we all have slightly different ways of saying what's a 4, what's a 4.5. And if you use that scale and my 4 is somebody else's 4.5, and you do that through a whole classification, that can actually change the outcome scores. So people would actually go around and try and shop for classifiers that would get them classified. So we had to kind of put that in. Para-driving is very similar with para-dressage in terms of our system. We look at the same, our overall classification card looks the same. We use a little bit different range of motion because, again, when we test riders for range of motion, if, for example, as a rider, do you want your arm up here? No, right? So as a rider, we only look for someone to go to like 45 degrees because that's really the most you're going to need for riding. So we'll look for a range based on riding. When we do the driving classification, we look for ranges that are established based on driving. So we have a slightly different, what's our baseline score? And how much range are we looking for different joints? So that's really the key difference with the classification. The testing is the same. All of that part is the same process that we go through. There are only 2 grades or sport classes in driving, grade 1 and grade 2. So those are done. And that's just, again, just based on the sport needs and how those functional impairments can impact the sport. What happens is you may have a profile in riding, and then a lot of times, that may go to a different profile or a different sport class in driving. So your profile may not change, but your sport class might change. So you might be a grade, 3 in para-dressage, but you might be a grade 2 in para-driving, because again, there's different sport classes. And part of that is what it looks in terms of what you need for that sport. There are also some of the profiles that are eligible for para-dressage that are not eligible for driving. So some of our really, really impaired grade 1s are not eligible for driving because they don't have the stability if the carriage is shifting and moving. And so there are a couple of profiles that are just not eligible at all. So again, this is just an overview. You guys can read through that. Our grade 1s are the more impaired carriage drivers. Grade 2s are the less impaired carriage drivers. And again, the not eligible profiles are at the bottom, so you can kind of skim that. And that's really made because those profiles may not have enough of an impairment to actually impact carriage driving, where it does impact dressage. So each sport has to kind of define what it needs in terms of mobility or strength or balance or coordination. And so the sport is what should drive that decision making on who's eligible and how we kind of put them into different groupings. Again, we kind of went through this part, but this is that summary of, again, new, review versus confirmed. So I think that we pretty much covered at this point. Reclassification, so this is again changed a little bit in the last couple of years. For national, we follow FEI rules. With FEI classifications, once you are confirmed, you do not get reclassified unless you submit significant medical documentation that there has been a change in your medical status. So you can get reclassified, but it requires you to go through USEF, through your federation. They have to submit the paperwork to FEI. That paperwork has to be reviewed and looked at. If they decide that there has been a significant enough medical change or a new medical condition that warrants reclassification, then they will allow you to get reclassified as a confirmed rider. Otherwise, you can't just go up to the show and say, you know what, I feel like this has changed and can you just look at me again? That doesn't happen anymore. Review riders are always kind of under that review process. One of the things we started doing in the last few years with review riders is before we would just mark them review, and then there was that rule of 6 months before a bigger like championship you had to get reassessed or reclassified. We've now made people review with a fixed date. So we might see a rider and say, you know what, we're going to review them in 2 years. Or we might have a rider that maybe has some really new medical stuff going on and we think it might be temporary, but so we might say we're going to review you in 1 year. Or we have a review rider that we feel they've been pretty stable for a while. We know there's a championship cycle coming in there. We might say we're going to review you in 3 years. So we tend not to do less than 1 year. We tend not to do more than probably 3 years. So 1, 2, 3, somewhere in that kind of ballpark. And again, that's clinical decision making as to why we want to review that rider sooner versus later. A lot of time if there's a new medical condition layered on, we'll review them sooner because we want to see them after that new condition is stabilized. If they've been doing the same thing and we're not ready to make them confirmed, but we think they're fairly stable, we'll do a longer review period. And we try to be mindful of WEG and Paralympic Games and things like that and not put their review date, like expire it right before the competition where they're going to be running around stressed out before the competition. So we're trying to be pretty mindful that if we're saying 2 years and 2 years comes just shy of WEG, that we actually put it for a certain date right after WEG. And then it's a little more fair to the athletes that they're not scrambling to get classified at the last minute. So that's really the process. Again, there are protests, there are appeals. I have not luckily yet had to go through one. I have had classifiers that I know that have gone through both protests and appeals. I did have an almost national appeal at one point, but basically it's a difference so they can, protest you guys as athletes can protest that somebody maybe is in the wrong grade. And that you don't feel like you've seen evidence on the back of and I was a groom before I was a para-classifier. So I know what goes on behind the barn. I used to watch riders that they would put them on 2 or 3 horses at an outside place, and then they'd take them to the show, and then they'd send them for classification, so they were tired. I've seen them pack them in ice, so their spasticity would get worse before they went in for classification. I've seen them walk them for an hour around the barn doing laps because again if they had something that related to endurance and fatigue and spasticity, if they walk for an hour, they go into the classification really spastic and really tired. You know, I've seen this as a groom, and it's funny because then I go share it with the classifiers and they're like, no, they don't do that. I'm like, yeah, this is kind of like, you know, and as a physical therapist that's dealt with a lot of different populations, I can usually tell when someone's trying their best effort or not. So, you know, I might not be able to do as much about it, but I can tell. And so it's a little bit challenging because I've seen that all happen. So as you guys as athletes are seeing this happen, please voice up about it, because then it's not fair to you guys. You know, that may affect that profile, that sport class that someone goes into. And then it takes away fair sport, and that's really what we're all about, is making sure it's fair sport. We want everyone to win, but you want to win because you deserve and you earned it, not because you played the system. And so that's really, you know, again, if you see that, speak up. It does cost a lot of money to protest and appeal, so that is a downside. And the other thing that we are now allowed to do is we are allowed to take video and photographs on the competition grounds of riders. So that is something that's helpful. So if you see us kind of taking videos around, we've taken videos of athletes mounting that supposedly couldn't mount on their own because they had too much weakness, and we watched them pop right up on the horse. You know, athletes that said they didn't have hand function, and we can take close-up video while they're riding of them picking up the reins and dropping the reins. And so, you know, IPC is really, really strict about misrepresentation and fair sport, and so we now have that ability, but it's a little bit tricky to still, you know, kind of make that call. So you guys could take video and submit it if you had concerns that on the competition grounds. So it has to be on show grounds, on competition. And it can be photos or video, but yeah, people could submit it to, you know, to the classifiers or to the stewards or to someone that's an official that could then take that information, you know, and then we as classifiers would have to decide what to do with it, and whether we want to move forward and do that protest, because that's never a fun process at all. Some athletes can appeal the process, so they could say we didn't follow procedure during classification, but, you know, again, we have a pretty strict procedure, so that doesn't happen too often. But yeah, so that's the tricky. Sometimes we just sit and observe, and we'll take video, because if they're in competition, they're not going to try and cover up, or, you know, even though they know that we're classifiers and we're videoing, they're still going to try and perform their best, because otherwise they won't win their class. And so a lot of times it's competition based or warm-up based observation. So challenges with fair sport. So that leads us to those issues. There are some issues with classification, and so we'd like to believe it's a fair, level playing field, and we try to make it that as much as possible, but there is misrepresentation. There is intentional cheating. I've had one classification that was probably the hardest one I've ever done, and I was sort of, I knew going into it that it was going to be challenging, and it made it even more challenging. And so, you know, again, you have to kind of pull out all your tricks and tools as a PT to get people to, you know, to show you what their strength and what their function is. You know, and sometimes it's really challenging to figure out how to do that and not anger the athlete or make them feel like they're being, you know, challenged, because then they get more defensive. It doesn't happen, intentional cheating doesn't happen very often. I will say you know, the whole of what I classify, everyone's really excited to be classified. They try their hardest, they try too hard often. So it's one in a, you know, small percentage that this happens, but it does happen. And it's hard for us to prove that they're, you know, cheating. How do you say that somebody's not lifting their arm as much as they possibly can, you know, without having an EMG or some kind of device strapped on that's giving you a force generation? So that's a little bit tricky, and we kind of have to just deal with that internally, and then that's why we do the observations. That's why we now have the video option where we can do that, is to kind of eliminate that part. Pain is something that we can't classify, and this becomes really challenging with some of our conditions, especially like the RSD, the chronic regional pain syndrome, because most of that, I mean, there's usually a layer of weakness and range of motion associated, but the biggest part of it is pain. And again, as I told you guys, we would all have different pain scales. Even if you hit everyone's thumb with a hammer the same force, we're all going to have different numbers for what that pain level is. So we can't classify pain. And if a rider or an athlete comes to us and they're in too much pain, and I've had this happen as well, where you literally barely put your hands on and they're going, ow, 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 you can't do that, don't push there. I can't classify them because I can't get a fair assessment of what their strength, their range, their coordination is. And so that is about one of the only times we can stop a classification outright at that point and say to the athlete, you have to come back at another time. And again, that's really hard on the athletes as well. And some will say, no, 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 I'll just bear it and go through it. And then they will complete the classification. Other times they will have to come back at another time. Proof of misrepresentation, again, as I told you guys, that's really hard to do. And so a lot of times that's going to be the video evidence that we have, or audio evidence or things like that. And so there are some athletes that we know are misrepresenting, and they're very good at it. And they've been very good with that system. Beyond classification in sport, it's something that they do with their disability, their healthcare, beyond just classification. And so we are not as gullible as we look. We are aware of it, but sometimes our hands are tied. And just because of liability in the system and the way that works, that we can't actually act on it. And that's something we would all like to fix. Medications, this is another challenging one. We always tell athletes when they come in to be on whatever medication they typically use. So if you're on a med and you use it, then stay using that medication. We've had athletes with Parkinson's not take their Parkinson's med and come in for testing. And then we can't get an assessment because they wouldn't not take their Parkinson's medication and then get on the horse. So now they're altering, basically, maybe not intentionally, but they come in thinking, okay, you should see me at my worst. But we really want to see you on whatever you would be on for your horse. And so in those cases, we'll send the athlete back. We'll say, nope, take your medication. When does it usually kick in? We'll come back and reassess you when you're at that point. So, medications are tricky in that sense. Again, spasticity is another one. Whether they take those anti-spasticity medications can really impact their classification. So the guideline, if you have an athlete, whatever they would normally take to be on their horse and riding is what they should be on when they come in for classification. Any braces that they wear, anything like that they use to be on the horse, have them bring it, wear it to classification. If we want to take it off, we'll take it off, but again, you want them to be in the same kind of state of mind, physical state of being as they would be when they compete, and that's what we want to see them at. So again, just to make it fair. Fatigue, fluctuating conditions, again, those are issues because they can change a lot. And so you might see a rider that maybe is classified really low and then looks like they're doing great one day. And that is something, again, we can't adjust for individually. We don't want to classify those riders every competition because that's not fair to them either. Especially with a fatigue type-based condition like MS, we classify them, we've wiped them out for that competition. And they may be too tired for that competition now. And we will impact their ability to perform at that competition because of that. So those are things to kind of consider if you have an athlete that maybe has a lot of endurance fatigue issues and you want them to be classified. Do your classification at a separate show, then go to a show to compete. And don't, because it is really taxing. The athletes will get really tired and sometimes sore after we work on them, and as you guys know, that's not the best way to go into your first 3-star. You want to be there at your peak, so you don't want that stress. So if you can find a way to get them classified before, get that out of the way and get that stress out of the way, because I'll tell you, when we classify, they're tired, I'm tired. It is a physically demanding kind of process. So do that before they have to compete, so that when you compete, we might still have to do the observation, but that's not anything really significant. New injuries, if there's new injuries, again, we will take that into consideration. We may ask a rider to delay classification for a few months. We had a rider with like a hip fracture. We were like, no, you can't get reclassified right away. Like you're 4 or 5 months out, you might be cleared to ride. We need to wait 6 months to a year for that new injury to settle before we reassess you and put you where you need to be. So that's something that has to be taken into consideration. Legal issues, there are lawsuits. Again, FEI is always dealing with those. So there are issues in terms of people not liking how we classify or what sport class we put them in. Anything tied to competition and money is always going to be subject to that issue. And then the other issue that we face as classifiers is the idea of, do we give athletes permission? So by me classifying an athlete, it does not mean I am giving them permission to get on a horse. Some of our athletes you'll see really probably shouldn't be on a horse, or they, one fall and that partial incomplete spinal cord injury is going to be complete. So classification does not equal it is safe for you to ride. That is your medical doctor's decision, and we try and make that clear in the paperwork that that is up to you, your physician, your other coaches, and that support staff. So we are not, by classifying you and giving you a sport class, we are not actually saying it's safe for you to be on a horse or it's safe for you to even compete in this profile. So if I had a rider that says, well, I can't canter, my doctor said I should never canter, and they got put into a grade 4. And I said, well, this is based on your functional impairments, this is your grade. However, you need to talk to your doctor about what you can physically safely do. We are not giving you permission to actually canter through this process. So that's a challenge. And then again, experience. We have, we try and do a lot of training with the classifiers. We go through a lot of training with FEI to classify at that level. It's a bit of a moving target, and it's a difficult system to kind of navigate, but you will sometimes have variations. So you may get a national classification, and then your FEI classification is different. And some of this is due to the national classifiers being newer, maybe not picking up on some of the details that the FEI classifiers will pick up on. So there may be changes, and it doesn't happen often, but it does happen. And so be mindful that you might be prepping for a grade 2, and thinking you're going to go into your FEI class and show, and you're going to be at a grade 2, and then you get FEI classification, now you're a grade 3. So it does happen. So just kind of be mindful. And again, sometimes riders on the borderline, and that's part of that decision-making process. So sometimes it's newer classifiers or inexperienced classifiers that maybe have done it for a long time but haven't done additional training. So there are some variations, and that's just part of the sport. So be patient with us. The last part of it is, again, where are we going? So you guys will probably see in the next 5 to 10 years some changes. FEI is just launching some research grants right now to look at what do we actually need to ride? What is functional impairment when you're on a horse? How does having poor coordination affect you on a horse? Most of the way the system was devised was basically watching riders and saying, okay, how much do you think you move your arm when you ride? Yeah, this much. How much do you think you move this? Okay, this much. We're doing more scientific-based methods to make those assessments and to kind of relook at the system, relook at minimum impairment. So the research is just getting started through FEI in the next probably year. So then you'll start to see that research happen. We may even change some of the testing process. Again, it's not going to be a fast process, so it's going to be rolled out over a long period of time. But that's where we're going. And the goal is just keeping the sport fair and keeping us in the Paralympic Games. I mean, that's really keeping us active and keeping it fair. So any issues, if you're trying to find a classifier, go to USCF. So as we said before, go to Lorene. She is the end all. So whether it's FEI, whether it's national classification, whether it's FEI classification, send it to Lorene and she will divert it to the right person at that point.
This presentation is part of a library of resources for understanding para-equestrian sports. And the presentations include an introduction to para-equestrian dressage, an introduction to para-equestrian driving, understanding para-equestrian classification. This course material is produced by Sarah Armentrout, head of school, Carlisle Academy, October 2017, with contributions from Joanne Benjamin, PT, HPCS, FEI classifier, Tina Wentz, PT, FEI classifier, and Carrie Sowers, PT, DPT, NCS, and FEI classifier. The copyright is owned by the United States Equestrian Federation, and duplication or disbursement of this material is by permission only.